And I always say it's you want something, but God has planned something other for
thing
you.
I really appreciate and admire about you, sir, is your lifestyle. Do you think that is possible for future upcoming plastic surgeons as well, concentrating only on aesthetic? Is it feasible?
So you see it is there. See, it's all about making a team and working smart. Hi, welcome to another episode of Plastic Surgery Podcast. And today we have not one guest, but three guests with us on our Plastic Surgery Podcast. All three of them are accomplished, well-qualified plastic surgeons, and they come from different parts of the country. One from Chennai, one from Kolkata, and one from Mumbai. And they are here with us for their 1 month fellowship of IAPS. So welcome Dr. Girish from Mumbai, Dr. Siddharth from Chennai, and Dr. Sabyasachi from Kolkata. First of all, I will welcome you all of you to our RG Aesthetic Center for aesthetic surgeries, and I would like to request you to please introduce your whole self for our audience. Dr. Sabya.
So I'm Dr. Sabyasachi Basu. I'm working as a consultant in Narayana Health, R.N. Tagore Hospital, Mukundapur in Kolkata. I did my MCH from Nair Hospital. Then I had a brief stint in Tata Memorial, Mumbai. Then I am here to learn aesthetics surgery with sir.
Great. So you have a very strong legacy background. Nair trained under Dr. Uday Bhatt sir, Tata Memorial, now working in Narayana. So welcome. Dr. Siddharth.
Thank you for having me, sir. I'm Dr. Siddharth from Chennai. I did my MCH from Stanley.
Wow.
And now currently I'm working with Dr. Shivram Bharadwaj, Dr. Anthony Aravind, and Dr. G.B. Rajan in Apollo Cancer Hospital, Tenampet. And I have my own setup as well in Ambattur, BM Orthopedic Hospital. And my exposure in aesthetic surgery was a little less. So I've come all the way to Delhi to learn from the master himself.
Welcome.
Rajat Gupta.
Welcome. Girish.
Hi, my name is Dr. Girish Miradskar. I belong to Thane and I have done my MCH from the same institute as Dr. Sabyasachi Basu.
Wow.
So I am from Nair and currently I am working as an assistant professor in the same department.
Wow.
And although our experience with aesthetic has been there, which is most as if you compare it to a lot of government or institutes is, but it is still limited in terms of rhinoplasty because we have Dr. Uday Bhatt sir with us.
Of course, the master himself.
But what we limit ourselves with is the abdominoplasties and body contouring techniques. So that is what intrigues me, and the mystery behind that. Over the past few days, I think you've done a lot of things to demystify it. So that is one of the great advantages of coming here.
Thank you. See, first of all, it is humbling that you all three are very accomplished, doing very well in life, assistant professors, having your own centers, Narayana, consultant, senior consultant. So that you all find us worthy, that you come here in Delhi, stay with us for a month, and it's all about keeping the academic environment, right?
So we wanted to ask why you're conducting this fellowship program and since when have you been doing it?
Okay, so thanks for asking this. So basically, this started off in 2018. Okay, so long back, 7 years back. We have had more than 100 fellows with us now. And how it started was, understand, in 2014-15 when I passed out, there was no structured fellowship program in this country. So I had to travel abroad and learn some smaller, finer nuances in aesthetic surgeries, which of course you keep on learning and updating throughout your life. But I wanted to shadow a good person, and we all learn aesthetic surgery, and for that matter, any surgery by apprenticeship, right? So then I realized that 1 hour volume picked up that why not we have some kind of program in India, because understand many doctors it's difficult for them to travel abroad. It's not about the costs only, it's about taking time off away from the country. It's not easy, especially when you become a plastic surgeon, you are already 32, 33 years of age. So it's difficult. So that's how it started. And the other personal vendetta is, when you are doing aesthetic surgery, especially in your independent center and you are doing well, you're doing good, it's very easy to have a big ego. And then sometimes a fellow comes in, walks in and innocently asks you a question which you don't know the answer, and it punctures your ego and you come down. So basically, it keeps the academic environment intact. Otherwise, it's very easy to forget the academics in the day-to-day life of just aesthetic practice. So that is one thing which I used to miss. Plus, I love talking and chatting and asking questions during surgery. You must have seen, right? So,
Yeah.
so I want new people to come and so that we can keep discussing. I also learn from all of you, right? So when you come, you will tell what Uday Bhatt sir was doing. So I will learn indirectly from the master himself about rhinoplasty. You will tell me in Apollo Dr. Shivram Bhardwaj what he is doing, or if you would have exposed with Dr. K. Ramachandran sir, how he will practice, how he will do. So these are small things which I also keep picking up. So all these big guys are doings of aesthetic for plastic surgery in general. So you kind of learn from every person you interact with. So that is my personal motive. And in this personal motive, if you end up learning something, that's your advantage. But my personal motive is this.
It's true, sir, that we have seen that most of our MCH, DNB, they are in government hospitals, and aesthetic volume otherwise in government hospital is little low, and that is why we don't get exposed to aesthetics too much. But everybody, most plastic surgeons harbor dreams of being an aesthetic surgeon at a later stage, and then the fellowship that you have been doing, the learning. So these are centers where Rajat Gupta sir is helping us to learn more of aesthetics, to give you a idea of what we should be doing in the later part of our life.
So I want to ask you, and you don't need to just sugarcoat. When you think of doing an aesthetic surgery fellowship, or how do you, when you come here, what are your expectations? What do you think that our center can improve on? हम में क्या कमी है, हम क्या improve कर सकते हैं, या क्या चीजें थी जो आपको लगा कि हाँ ये मैं चाहता था और ये हुआ? Any of you can answer this.
The reason first being why I chose this center was looking back on the fellows who attended it and certain publications which have been done. I saw that there was a vast variety of aesthetic cases being done here compared to other centers. It's not just restricted to breast or abdominoplasties or face. Here, there's a vast spectrum of cases being done.
Yeah, we're blessed with that. Yeah.
In one center, getting so much of volume of cases and so much of variety of cases is really helpful for the fellows to learn and go about it. And
a lot of times what happens is that you end up seeing only one of the one surgery of a particular type. So what happens is you in the turn of events you tend to miss a step or two. When you visit a high volume center, you see that regularly, repeatedly, so that it gets imprinted in your brain, and slowly and steadily, obviously the confidence in your ability to execute them also increases.
Yeah.
So that is the motor coordination that takes place only by visualization. So when you visit a high volume center, definitely that helps. And having a background in aesthetic, it becomes even more important because you feel you're doing the surgery, although you're not doing it, but you're doing it, you're observing it, and suddenly a different movement comes in, and that is when the magic happens. So then suddenly certain things strike you, and obviously you make those changes in your mind, and you feel ki, this step I can do a little different. Okay, and you see a lot of different outcomes. Not only we are able to see the intra-op things, but also we are able to see the patient's post-op and the results, and how it benefits them psychologically.
Yeah.
And having a vast spectrum not only means a lot of surgical, but also a lot of non-surgical work also. So it overall gives a very well-rounded exposure to aesthetics, I think, which not a lot of centers have, honestly.
Another thing I would like to add is we all follow results. We all see results. So of course, when we have seen, like I am from Nair, I have seen a lot of rhinoplasty being done there. We have trained in gynecomastias, and then I had attended another fellowship for hair transplant as well. So I was doing all these cases, but then I was worried that how should I do this abdominoplasty, and then I saw the sharp technique results and the difference that it creates. So you feel that you want to learn that how this is done and how this can be done, and you want to imbibe that into your practice. And results is one of the reasons that has brought me here.
And not just that, but we are able to see the entire ecosystem that you've built around it. So that is something worth replicating or even being emulated. So it is not just one person works, it is a team that is worked. So if you're able to build a team and you know what tasks to give them, so your job becomes easy and you can focus more on the results.
Yeah, see, surgery is always a team game. Especially when the volume increases. If you're alone, you cannot do justice to every aspect of surgery. And it's not just surgery, it's about pre-surgery consultation. Then investigations, then noting those investigations down, medical history down of a patient, then taking them for surgery, then post-surgery recovery, follow-up visits. All that thing has to be done by a team if you have a high volume center. And unless there is a team, you can't do. I don't think you can do it. Anyone can do it. So we are blessed to have good volume, good spectrum, and a great team. Yeah. Another thing what I want to know, why aesthetic surgery? What attracted towards aesthetic surgery? You all, you want to be a pure aesthetic surgeon, or you want to do all of them, all plastic surgery, recon, micro, burns, hand, and aesthetic as well, or you want to become pure aesthetic surgeons like what I have now become?
My exposure to aesthetic surgery was less. That's why I wanted to get a broader perspective on plastic surgery. Plastic surgery entails everything.
Yeah,
right
sure.
from
It's a
aesthetic
huge
to-
field.
yeah.
Plastic surgery is a huge field. Yeah.
So, getting an idea, an overview about aesthetic surgery was my view why I came here.
And then when you go back, you will do all of them and incorporate these procedures much more in your practice, right?
Because I'm starting out, I'm yet to figure out
What do you want to do?
what I want to do. Whether I want to concentrate only on trauma, whether I want to concentrate on head and neck, or whether I want to concentrate on aesthetic surgery. So I'm yet to decide that. So this will be a stepping stone for me and will definitely shape it up where I'm going to.
Lovely. For you, Sabya?
The city I come from, there is a lot of demand for aesthetic surgery, which I feel. And I feel that I would be able to contribute a lot to aesthetic surgery in my city while I go back. And whether I should be continuing aesthetic surgery along with plus other things or not, that I think it is too early to say. That will depend slowly, and that is let time decide that.
Sometimes I always say it's you want something, but God has planned something other for you. So yeah, for you, Girish, you are an assistant professor, so you will do everything.
Yeah, so currently I'm doing my bond, but once I'm out there, again, I plan to have a hybrid.
So on record, you are saying you will not continue in IR as assistant professor.
After 2 years, you can say that. It is difficult getting into an assistant professorship.
Of course, yeah, that's why.
So again,
I hope Dr. Uday is not watching this.
if yeah. So if sir is there with us, then definitely I would like to. But again, yes, as we rightly mentioned that private practice is what I'm looking for. Initially, I would like to have a hybrid practice because I'm aesthetic and reconstructive is both very dear to me.
Yeah, of course. So I miss those recon days.
Yeah.
You know the sorry to interrupt, but the high when you take out the clamp and there is no leakage of the blood and it goes shoo, that gives you a different high, which I miss nowadays.
Yeah. So having both of them helps each other, because in reconstructive also you need to give a lot of aesthetic outcome. So having a good aesthetic outlook towards reconstruction will definitely help you in your reconstructive practice as well. Having said that, yes, there is a lot of demand for aesthetic surgery, and we see a lot of people having, especially in metro areas wherein there is a very good mix of population. A lot of people would want to go to maybe some med spas or some places like that, and they don't have good results. But at the same time, I want to encourage them to come to plastic surgeons and have their aesthetic surgeries done, so that they get the best of what plastic surgery has to offer in terms of aesthetics.
So let's also talk about this fellowship program, which we now incorporated in IAPS, and you all are IAPS members, and that's why you got this fellowship as IAPS fellowship. So what do you think about IAPS? How it is growing? How does it help you contribute? How IAPS has contributed in your growth? What do you expect from association IAPS? And Sabya?
I have been a apps member for almost 3 years now, and I have seen more and more members come into the fold, and the plenty of work that is being done, starting from the abs pathshala, the gurukul, everything combined. And I would like to thank IAPS for this fellowship very, very much. I have done 2 other fellowships, these small fellowships, but they are not a part of IAPS. And here I was selected, and I could come here and see such good surgeries, such nice surgeries, imbibe them, and I could do them in my practice. I am very thankful for IAPS. I wish IAPS all the best, and I would like to be a part of IAPS as much as I can.
IAPS as an organization has done very well for itself, and not only in training the junior plastic surgeons, it's giving like feedback and recognition for the plastic surgeons as well in the main forums and in the conferences. And the main Gurukul, which is organized by IAPS, is very beneficial to the junior plastic surgeons, which I feel. It's like it's giving a platform for the plastic surgeons, the junior plastic surgeons, to come up and learn and practice their new skills and get a hands-on experience, which is not very much done in other associations, which I feel.
Girish?
So I've been a reader for quite some time, and having access to good material always helps. So every Sunday we have an article coming in. So that certainly
That's amazing, which the editorial team does. Dr. Hiren Bhatt, Dr. Kalra, everyone contributes to it. It's amazing that how they end up doing every Sunday.
Yeah. So, and another new the journal that has been published, IJAPS, is something which I really look forward to every.
The next issue is coming in next 10 days.
Yeah. So that is something, and obviously in addition to that, the workshops that are held across the country, like we had Rapta. So such events help us not only hone our skills, but also they're available at a very less cost.
Yeah. 5,000, 6,000 rupees. Yeah.
For somebody who's like me, like starting out, the cost is a major factor when it comes to having upskilling yourself. So that certainly helps.
Even this fellowship.
Yeah, the fellowship is free of cost. The fellowship is free of cost. All you need to do is just apply.
I wish if I would charge something, I would have been a billionaire. But what to do with this billion when I have friends like you, which I make during your fellowship program, right? All of my fellows, we are into big family of RG Connect now. Now, any message you think you want to give to residents, because a lot of residents want to do aesthetic surgery fellowship during residency. What are your thoughts? Should it be done during residency or after residency? I have my own thoughts, but I want to hear from you, because I get residents from Manipal, Safdarjung, TMH, Ganga, all these big institutes. I get residents during their MCH plastic surgery program, and I see a lot of difference between when they come, what are their thought process about learning aesthetic surgery, and when you guys come after your MCH. But do you think that it should have been beneficial during your MCH program or after it?
There are many factors to it. First, if the resident is inclined for aesthetic surgery, if the residents, where is the resident working? If he is inclined, like in TMH, they are very much inclined with reconstruction, and they want to build their life over onco reconstruction. That is why probably they are in TMH in the first place. But then if they're interested in aesthetic surgery in the future, in the long term, then they can obviously come over here, learn the nuances of aesthetic surgery, and then apply in their own field. And then this becomes a very good thing for them. But at the same time, if they're not inclined, then the fellowship gets wasted. Of course, the second good thing, if you are doing after MCH, you get to know that what are your choices, what are your options, what are you trying to do, or what you want to do in your life. Then taking up this aesthetic fellowship, then you are in the flow of things. You understand that this is how it is done. You are in a better prepared way to take things in and understand, and then apply it in your practice.
Sure.
I feel that the fellowship is more beneficial when you start your practice and then take it up. Mainly because when we start our practice, there are a lot of hiccups in it. Initially, certain cases when we do it, only when we start doing it, we'll come to know the difficulties involved in it. Like per se the plane of dissection or certain areas where correction.
Small things, how to take a suture, which suture to take first. Yeah,
small things to do. And when we come to a fellowship, all those doubts we have when we start the practice gets cleared up.
Yeah.
And when we learn from teachers, like you, sir, and we also get new ideas and new skills which we can carry it onto our practice, which I
Absolutely.
feel. And when we do it in residency, it's a big gap between when we start our practice and when we finish our residency. So in that period, I feel that if we don't have a working practice or we're not doing cases in that
Then you
period,
become.
it gets lost.
I believe it should be only after MCH. Having being an MCH graduate, freshly prepared into the world, a lot of times what happens is you tend to read more. Obviously, you're reading throughout the year, but you tend to read only during the time of exams, the last 3 months or last 6 months. That is where you do the bulk of the reading. So if anybody is coming, maybe say at the end of the 5 terms, they've not caught up with the knowledge in itself, the reading part. So once you've read thoroughly, yes, then you will be able to identify certain things that you wouldn't have.
As they say, eye sees what mind knows.
Exactly.
If your mind does not know, then you don't notice those small things. Yeah, so each has their own advantages. I get residents, so I see that when they come, sometimes they think that, oh, I want to do aesthetic surgery, but my prime focus right now is to pass an exam. So I would not read this. They will not read and come my work, my surgeries. They will be reading like ALT flap a day before I'm doing a tummy tuck. So that does not make sense. Yeah.
Helpful.
So because their mind is right now looking at passing exams, and they sometimes don't know pick up those small things. But the other part is they get exposed to aesthetic surgery, like you said in TMA. They're not exposed to aesthetic surgery at all because the volume of onco reconstruction is humongous, and they're exceptional onco recon surgeons they become. But they don't know what aesthetic surgery is. So unless they know, they don't know what they're missing out. So it is, I don't know. Yeah, it's a balance. Yes.
Tell us about your journey, about your setting up this clinic and all. Setting up your aesthetic practice.
See, I've said this in my podcast before as well. I wanted to become an aesthetic surgeon when I was in school. So it's like a dream. I'm living like a dream. Okay. So I took up biology to become an aesthetic surgeon. So from then to the MBBS, I did not know that you have to do a general surgery before becoming plastic surgery. I was very upset when I got to know this. That what means I have to waste my 3 years doing general surgery. But now I feel it's not a waste. But at that time, then after general surgery, I thought I straight away become an aesthetic surgeon. So again, it was a shock to me that, oh, I have to do plastic surgery and go in burns and everything and do that rotation. I was actually very upset. But then I did aesthetic surgery fellowship and so on. So setting up the center was, I wanted to have a center of excellence. So, it's a lot of people want multiple chains of clinics and centers. I never wanted. It's still never in my mind. One center of excellence from top to bottom, covering all aesthetic surgeries and having a big team which can do all the surgeries. Like I may not be very good in one surgery like genital rejuvenation surgery. So Dr. Priya is there. I may not be good in lasers. I don't understand. So I have dermatologists in my team who does that. So it's a big team, and I can't do everything alone. I cannot be master of all, right? So I do few things which I'm good at it, maybe 4, 5, 6 surgeries which I do, and the others are also there to do good. So if patients from India, Delhi, across the globe wants to know, oh, we go there and everything will be done. There'll be good person for everything. So that was the idea. And the other thing was that we also chill. You see, we chill during our lunch breaks. We talk, we chat, we gossip. And that was the idea what I picked up in my fellowship when I went in Barcelona, that you do good surgeries and then you go have a good chill. You go have a good chill life. You do not, working from 14, 15 hours every day continuously. The whole team gets the aesthetic surgery is an art. So you have to we do it in an artistic way. If you see in our hospital, there are a lot of arts in the walls, right?
Yeah,
so it is a reflection of who we are. We don't post before and after pictures on our walls. We post art because we all are kind of artists. So that was the vision on how we created this hospital. I'm proud of what we have created. It's center of art, good model OTs, very nice functioning. The team is good. Our nurses are also very, very good. So that has been the journey. God has been very, very kind. Yeah.
One thing I really appreciate and admire about You, sir, is your lifestyle. How you start your surgery by 9 and wind up your day by 6. And then you have the rest of your day. And in between also, it's not very hectic for you.
Yeah.
So that is the kind of lifestyle what I expected I'll be doing as a plastic surgeon. But do you think that is possible for future upcoming plastic surgeons as well, concentrating only on aesthetic? Is it feasible?
So you see it is there. See, it's all about making a team and working smart. I'll tell you one thing. Working hard and long hours are over exaggerated and over glorified in healthcare. This has always been people. Working smart is not glorified. In fact, you have to be working smart so that your long hours can become short. You have to make systems in place. Like if you see in our patient's file, there are systems. Tick, 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 tick. Even our OT notes. Everything is quick.
Systematic.
Even my consultation scripts, you see, it's a script. I don't miss any point, but it makes me fast. So that is what the systems you have to create so that you are systematic, you don't miss anything, and you finish your work fast. And same it goes in our surgeries also. We do long surgery, but we do it in short time. Why? Because there are systems in place. Everybody knows what they need to do. I don't need waste time in looking for instruments, thinking about what I'm doing. The surgery is done in our head before we actually start the surgery because all the steps are already there. We just have to now go and execute. We don't think while operating. Of course, we think while operating. We are not, oh, let's do this or do this. We know what we have to do.
Yeah.
So if you go with a clinical fashion and it's a well-oiled machinery, so then you can have a good balance. And I aim to still finish by 5 o'clock. I end up finishing at 6. I hope we start finishing by 5 soon. Yeah.
Definitely you will, I think.
For any fellow who is coming in right now, so what are your expectations out of fellow, and what do you think a fellow should be able to achieve during their fellowship?
Okay. First of all, I'm a voracious reader of aesthetic surgery. So I want my fellows to read. Don't think this is a taunt to you guys, okay? So I want you guys to read every surgery we are doing the subsequent day. My surgical list is planned for next 1 month, 2 months, right? So you already know what next day is going to happen. So you need to read that so that, as we discussed, your eye sees what mind knows. So if you know what is there written in the books, and we are doing the same steps, or if we are doing different steps, then you can ask and discuss why we are doing different than what is written in the standard textbooks. The other thing is learn how to create the systems what we have created. This is what I learned in my fellowship. You may end up doing recon, you may end up doing mix of both, you may end up doing only aesthetic. But the systems how we have created, which I'm really proud of, that can be incorporated in every kind of practice. That is something which I want my fellows to learn from us, because I think that is something which we have uniquely done. Enjoy life. Work hard, but work smart. That's something which I always tell. And keep contributing to the field. Keep training someone else. My guru, my boss. I remember when I finished my fellowship day, I was emotional. And I told him that I want to give you something. He did not charge a single penny from me. I've never given him anything. He has only given it to me, right? I used to have lunch with him. We have partied together. He only, gave it to me. I didn't give him anything. I said, I want to give you something. And he said, the only thing you can give it, continue this cycle. When you become accomplished, you start training someone else. And let the cycle go on. When I used to train, there were some teachers in our time who would make that surgery sound very difficult. You can't do this. Only after so much experience you can think of doing the surgery. We have all heard the stories, right? To make the surgery look easy, that you can emulate, is the best thing you can give to the next generation.